Hi, Oluchi here. Today I'll be talking about alarms. There will be alarms. There will be more alarms. And then there will be more alarms. Yes. There will be a lot of alarms. We know that one of the major duties of a nurse is to monitor patients. And then to do that, because you have more than one patient to take care of per time, you need assistance in letting you know how your patients are doing every single minute. So that's why the alarm, or that's what the alarm systems do. And then more so, unlike back home where we have open wards, with the nurses station somewhere located somewhere in the ward where you can, with just one sweep of your eyes, you can see all the patients and see what they are up to. Here, it's a room. They have rooms. Patients are in rooms. Could be private rooms where there's just one patient, which is even more common, or semi-private rooms where they have two patients with maybe a demarcation in between or something like that. So with that, you cannot see the patients while you're in the nurses station. You don't know what they are up to. So that is the more reason why the alarms become necessary. But there is a bunch of them. When the patient tries to get out of bed, the bed alarm goes off. When the oxygen saturation drops, the alarm goes off. When the heart rate drops, the alarm goes off. When each of the settings on the ventilator is out of the normal range, and alarm goes off. And this is especially true in higher levels of care like ICU. The alarms in ICU is in another level, because the patient, in the patient's room there is a monitor, and on that monitor it displays the patient's parameters, and per time there is at least, the bare minimum is maybe like 5 parameters there: blood pressure, ECG, oxygen saturation, heart rate. There may be other parameters such as monitoring for central venous pressure, arterial blood pressure, so many of those kind of things that happen in the ICU. So the more monitoring the patient needs, the more alarms goes off in that patient's room. So, and then on top of all that, there is the call light. The call light is a device that the patient can use to communicate with the nurse. If the patient wants the nurse in the room, the patient presses the call light. If the patient needs water, presses the call light. Is in pain, presses the call light. So at the end of the day, all you hear is bells ringing from left, right, and center. So the tempting thing to do is to ignore the alarms when it gets to a point, because alarm fatigue. Alarm fatigue is a thing. It's one of the things that affects nurses. So the tempting thing to do is to shut off your brain and not listen, but don't do that, because sometimes you going into that room at that time when the alarm went off spells the difference between life and death for the patient. I know that some of the patients can call for ridiculous reasons, such as they will call to see if somebody will come, call to see if the people are on top of their jobs or something like that. In fact, there was a time that a patient called. I went in there and he wanted his call light. Meanwhile, it's the call light he used to call. So yes, it could get that crazy, but don't be tempted to ignore the alarms. Another thing you can do to filter out the alarms that are useless is to change the settings. Now, some of these settings are prescribed. If they are you shouldn't mess with what is prescribed. If it is prescribed, it is prescribed. But there are times that, like patients with COPD, their baseline oxygen saturation is usually between 88, 89, because of their condition. So such patients, there will never be a time that the alarm will not go off if you don't set it at that, if the smaller limit at that, maybe 88, the lesser unit at 88. If you leave it at, say, maybe 90, 91, 92, or 95, it will continue to go off because that patient's condition does not allow, even with supplementary oxygen, it does not allow for the saturation to go higher than that. So in such cases, if you need to get an order from a doctor to reset it, to 88, so that when it goes off, it's genuine. So that is one of the things you will do. Another thing is, when you go in the patient's room, you cluster care. Try to do everything that the patient needs at once so that the calls will reduce. So I'll stop here. Thanks for listening. Make sure to like, share, subscribe, and follow for more.